Good afternoon, everyone. My name is Joseph Kanyike, and I am so much excited to be here today discussing about how trusted communication, faith-based partnerships, and community engagement are helping to prevent the spread of Ebola in Uganda and DRC. As of today, Uganda continues to maintain a strong response linked to the Bundibujo strain originating from the DRC. Uganda has recorded 20 confirmed cases, including 2 deaths. But encouragingly, for the past 7 days, there has not been a new case. The numbers had stagnated at 19 until today. Today we've had a confirmed case, bringing the total number to 20. And this has come as a result of effectiveness in rapid surveillance, contact tracing, community engagement, and coordinated public health action. Meanwhile, our neighboring country, the DRC Congo, continues to face a significant outbreak with more than 1,000 confirmed cases and over 250 deaths, as my friends will continue to expound about it. The threat of cross-border transmission remains real, particularly for communities along our northern and western border. But as I report, there has been confirmed cases in Kampala, and also contact tracing has been reported in western areas of Ntungamo and all those districts surrounding the DRC Congo. Uganda's success has not been achieved through enforcement alone. It has been achieved through trusted community engagement, rapid response systems, border screening, contact tracing, public awareness campaigns, and partnerships that place accurate information directly into the hands of the ordinary people. This is where the partnership between Harper Hill Global and the Global Methodist Church in Uganda has become especially important. Together, we have developed a rapid response communication strategy designed to reach people with life-saving Ebola information as quickly as possible. And we are doing this through SMS messaging, WhatsApp distribution networks, community outreach, and church communication systems. We are sharing accurate prevention messages throughout our church community in Uganda, as well as, everyone is targeted regardless of whether they are Christians, because Ebola does not know, it does not differentiate. When it comes, it affects everyone. Recognizing that many vulnerable communities have limited access to technology, Harper Hill Global has also helped us advocate for and provide portable educational tools. This includes a projector, a screen, a speaker, a laptop, and a solar-powered equipment. These mobile learning platforms allow us to bring prevention education directly to remote villages, refugee settlements, churches, schools, and broader communities, especially those communities along the border between Uganda and the DRC. In addition, Harper Hill Global has partnered with the Global Methodist Church to mobilize critical prevention and hygiene resources. We are buying hand washing cans, water jerrycans, liquid soap, sanitizers, gloves, sprayers, and temperature screening equipment These practical tools reinforce health messages being delivered and strengthen community resilience. And we have picked out churches that are going to be able to benefit through distribution of these items, especially those churches along the border between Uganda and DRC. Still, many communities along DRC-Uganda border have experienced significant economic hardship due to movement restrictions and reduced cross-border trade. Recognizing these challenges, plans are underway to support some of the most affected border and refugee communities through targeted food assistance and community support initiatives. What makes this approach unique is that it empowers local faith leaders and community communicators to become trusted public health messengers. By equipping churches and interfaith networks with evidence-based information, training, and communication tools, we are creating what Harper Hill Global calls a blanket of communication across vulnerable communities. Yes, we are using a myriad of strategies to be able to reach out, and Harper Hill Global calls it a blanket of protection. Indeed, the lesson from this outbreak is clear. Information saves lives. When communities received timely, accurate, culturally appropriate information from trusted local voices, they are empowered to protect themselves and their families and their neighbors. On behalf of the Global Methodist Church in Uganda, I extend our sincere gratitude to Harper Hill Global, our health partners, faith leaders, donors, and volunteers who continue to stand with vulnerable communities during this crisis. Together, through faith, partnership, community engagement, we can stop Ebola and strengthen resilience for future public health. Thank you, and may God bless you all. Bye.